Let's move now to our focus on COVID-19. We know that over 7 million doses have been administered so far. The acting health minister confirming that we're now administering 1 million jabs over a 4-day period. But there are other questions around the vaccines, and the Health Justice Initiative is calling for access to our country's vaccine contracts. They believe transparency and an open accounting system on how decisions are made on COVID vaccine procurement is the best way to manage the pandemic and make the right health calls. And I'm joined now by Fatima Hassan, who is the director of the Health Justice Initiative. Good evening. Thank you so much for joining us. So are there specific contracts that you want to have a look at, or are you saying as a matter of principle all these contracts should be open and accessible?
Thanks, Sally. Good evening, and to your listeners. So the Health Justice Initiative has asked for some time that government voluntarily disclose all of the vaccine procurement contracts, specifically with Pfizer and Johnson & Johnson, because those are the two vaccines that South Africa is using for its vaccination program, but also the contract with COVAX, as well as the African Union Vaccine Acquisition Task Team. So any mechanism that is meant to be supplying vaccines to South Africa, where the public is paying for those vaccines, we believe that those contracts in a pandemic in the public interest should actually be disclosed and should be made available. We've had to resort to filing a promotion of access to information request, as have many other groups in other parts of the world, to enable government to give us the reasons why it will or will not disclose these contracts based on what we believe are non-disclosure agreements that they've signed with multinational pharmaceutical companies.
Why would they have to sign non-disclosures? What would they not want us to know?
So we believe that many of the front-runner vaccine manufacturers, which basically are the multinational pharmaceutical companies, have insisted globally, not just in South Africa, that there be non-disclosure agreements in order to have a high degree of control around the terms and conditions of these contracts, and to basically make sure that there is a very high level of secrecy. We certainly don't believe that you can have these kinds of levels of secrecy in a pandemic. We've seen what the supply crisis is, the situation that we currently have. So we don't know in terms of these contracts what the exact pricing arrangements are, what other obligations government has in relation to these pharmaceutical companies, what the volumes are, what the provisions are for breach of contract or non-delivery, as we've had with Johnson & Johnson in particular. We don't know what the penalty regime is basically within each of these specific contracts. And so the public really is in the dark. We get irregular briefings on an ad hoc basis, mostly through the hard work of investigative journalists, just to know when supplies are actually coming into the country. So there's a lot of information, we believe, that should be shared. Just yesterday, the People's Vaccine Alliance globally released a report which showed that based on the information available to us, because not all of these contracts have been made public, there are multiple countries, including in Africa, that are paying more for the vaccines than our counterparts in other parts of the world.
Could that not be because some of those countries made an initial investment up front during the stage where we were not sure which companies would be the ones to develop the successful vaccine? Is that not part of the added costs that we are paying, perhaps?
Well, we don't know. Until we see the contracts, we really don't know which contracts have loaded a premium and which contracts are basically charging are charging a premium or a surcharge. The critical issue that we're also trying to establish through these contracts is whether multinational companies have actually forced the hands of many governments, including our own, not to impose export restrictions or to allow certain customers to be what we call preferred customers, where vaccines will first be diverted to them and then only will the vaccines be available for people in South Africa and Africa. And certainly we are concerned about the arrangement that government has in place with Johnson & Johnson, not just in relation to the contract between Johnson & Johnson and Aspen, but specifically the terms and conditions of the agreements between Johnson & Johnson and the South African government.
Why do you have specific concerns around Johnson & Johnson? You know, whenever we speak to Aspen, they say it was one of the few companies that actually was prepared to invest in South Africa and allow the product to be filled and finished. So it sounds like, in a way, from their perspective, Johnson & Johnson actually was more prepared to help Africa than other manufacturers.
Well, we'd like to see the contract so that we can establish whether that is the case or not.
Fair enough. And what reasons are you given when you're denied?
So we've lodged the access to information request, and we're very encouraged by the response from government that we actually received earlier this morning, which basically indicated that the Department of Health will now will notify all of the different vaccine manufacturers that we've asked for copies of the contracts, and will receive both written and oral submission from them about whether they would like to make it public or whether they would not like to make it public, whether they're willing to disclose it or not, or whether they're willing to disclose parts of it. Be that as it may, we'll give government some time to deal with that particular process, and if necessary, we'll have to take then, further legal steps to ensure that our courts will actually make the final determination on what parts of this contract should be made public and what parts of it should not be made public. We believe, as the Health Justice Initiative and as part of the People's Vaccine Campaign globally, that all of the contracts must be publicly available. We just can't have organizations around the world having to spend so much time and energy to try and get copies of contracts where the public is actually paying for the vaccines. And your question earlier about the amount of investment that was put into the vaccine research was actually funded through public support and public resources by many people and by many countries around the world.
You did have a bit of a win yesterday. You've been trying for a long time to get access to those Ministerial Advisory Committee briefings. Now, am I correct that this was around the issue of that the scientists, the researchers would give medical advice to the politicians, essentially, who then have to decide which bits of advice they're going to take and which bits they're not? Are those the briefings you've now got access to?
So what happened in the last few days is we obviously filed an access to information request for all of the MAC advisories as well as the VMAC advisories. So there's the Ministerial Advisory Committee, and then there's also a Vaccine Ministerial Advisory Committee, which falls under the larger body of the MAC. We filed an access to information request about a week ago, and within a few days, a number of the MAC advisories, even from as far back as January 2021 and February 2021, have now been loaded. We're busy studying those MAC advisories so that we can see whether there's been alignment with the advice and the expert opinions provided by the MAC advisory members to government in the decisions that it's taken in the last few months in relation to, one, the age cohort prioritization, in relation to comorbidities, in relation to vaccine selection. So there's been a number of decisions which one would imagine rested on the scientific experts and advice within the MAC, and we'll be studying to see whether that is what is actually panned out.
Anything interesting come out so far? Or plenty to wait?
Well, there's some interesting... There's a lot to wade through, with some interesting advisories on what the MAC thought about population immunity, and also in relation to the decision to pause AstraZeneca in South Africa. But like I said, we'll be studying all of those. A number, quite a large number, have actually been placed on the website. We'll also be studying to see which ones are still missing, because we believe that there are a number of MAC advisories that for some reason or the other are still not being made public, and we believe that it's important that the public actually sees what that advice actually was.
Look forward to hearing from you when you've gone through all those briefings. Thank you so much for your time this evening, Fatima Hassan, Director of the Health Justice Initiative.